Hi everyone, in this video I'm going to discuss about suctioning. I am Julin K. Thomas, faculty working in Tripoli College of Nursing. The objectives of this discussion include the group should be able to define suctioning, brief the types of suction catheters, describe the procedure of suctioning, and enumerate the complications associated with suctioning. Suctioning is a procedure of removing secretions from the respiratory tract. So aspirating secretions through a catheter which is connected to the suction machine or a wall suction outlet. So this suctioning can be done either in upper respiratory tract or in the lower respiratory tract. What are the different sites for suctioning? Suctioning can be done through different sites: oropharyngeal, nasopharyngeal, endotracheal or tracheostomy. In oropharyngeal suctioning, the catheter is inserted through the mouth and the secretions will be removed from the upper respiratory tract. In nasopharyngeal, the catheter is inserted through the nasal cavity and the secretions will be removed from the upper respiratory tract. So both the oropharyngeal and the nasopharyngeal will be used to remove the secretions from the upper respiratory tract. Endotracheal suctioning, the catheter is inserted through the endotracheal tube and the secretions will be removed from the lower respiratory tract. Tracheostomy also, the catheter is inserted through the tracheostomy opening and the secretions will be removed from the lower respiratory tract. So endotracheal and tracheostomy suctioning will be used to remove the secretions from the lower respiratory tract. So while suctioning, during oropharyngeal or the nasopharyngeal suctioning, the secretions will be removed from the upper respiratory tract, while in endotracheal and the tracheostomy suctioning, the secretions will be removed from the trachea and the bronchi or from the lower respiratory tract. Purposes of suctioning. The oral or the nasal suctioning can be done either to maintain our oral or the nasal hygiene, to provide comfort for the patient, remove any blood or vomit in an emergency situation. On the other hand, the tracheal or the endotracheal suction, it is used to remove pulmonary secretions in patients who are unable to cough and clear their own secretions effectively. When there is a thick tenacious secretions which is present either in the lower respiratory tract in the trachea or the bronchi, this tracheal or endotracheal suction can be used to remove such type of secretions from the lower respiratory tract. Suction catheter. So this is the image of a suction catheter. So what are some of the features of the suction catheter? So suction catheter, it is used for removal of secretions from trachea and the bronchial tube. So this is a traumatic soft and round open tip with two lateral eyes. At the tip of the catheter there will be small opening. It is very soft, frosted and kink resistant nalaton tubings. So different types of color codings will be used for easy identifications of the suction catheter. Based on the tracheal tube size, the size of the catheter will varies. So extra smooth low friction surface tubings facilitates easy intubation. So if you see the specifications of the suction catheters will be available in different sizes. The sizes varies from 6 to 24 with 25 length. The color we also will have different color codings. The lure will be different color codings for easy identification. Types of suction catheters. The types of suction catheters include whistle tip catheters, open tip catheters, Nelaton catheters, Yanger suction catheters. In whistle tip catheters, there will be small opening at the tip of the catheter. It can also be called as eyes. So it has a less irritation to the airway. So that is the benefit of this whistle tip catheters. In open tip catheters, there will be large opening at the tip of the catheter, so it is more effective for removing thick mucus plug. When there is a large amount of secretions which is present in the respiratory tract, if you want to remove thick secretions, this open tip catheters can be used. Yanger catheters, usually this Yanger catheters, it is made of stainless steel or plastic. So this suction tip is very rigid and hollow. If you see, there is an opening for rapid clearing. There is an opening at the tip which helps in the rapid clearing of the secretions, and the bulbous head that offers a ready access to the delicate laryngeal tissues without any damage to the surrounding tissues. So it will reduces the complications during suctioning. So the suction catheter, it is curved for easy access into the lower respiratory tract, commonly used to prevent aspiration. So Yankauer catheter is used for oral suctioning. The other one is the Nelaton suction catheter. So this is a 40 centimeter long sterile catheter which is made up of a PVC material. This is latex free, and this transparent PVC will allow the visibility through it. So we can see the secretions which is coming out through it, and different types of color codings are used to identify the sizes of the catheters, and this catheter is a rounded tip one. Suction catheters. So what are the different sizes of the suction catheter? So based on the tracheal tube size, we have different color codings and different sizes for the suction catheter. So if you see the size 6 French, so it is usually represented with French. So 6 French, that is light green, 8 French, it is blue in color, 10 French, it is black in color, 12 French, it is white in color, 14 French, it is green in color, 16 orange, 18 red, 20 yellow, 22 violet, and 24 light blue. So these are the color codings of the suction catheter. So the tube, the end of the tube, the luer will be coded with different color codings based on the size of the tube. So when we compare with the tracheal size, so how we can identify the suction catheter? So if the tracheal size is between 2.5 to 3 millimeter, we can use a 6 French suction catheter. If the tracheal size is between 3.5 to 4 millimeter, 8 French suction catheter can be used. If the tracheal size is between 4.5 to 5.5 millimeter, a 10 French catheter can be used. If the tracheal size is between 6 to 7 mm, a 12 sized a 12 French suction catheter can be used. If the tracheal size is more than 7 millimeter, then a 14 French suction catheter can be used. So this is the size of the suction catheter, how we will select the suction catheter based on the tracheal tube size. How we will select the suction catheter using the right size. So if it is an adult, we can use the size between 12 French to 18 French. If it is a children, we can use the suction catheter. The size varies from 8 French to 10 French, and in case of infant, the size varies from 5 French to 8 French. So always we'll select the suction catheter half the diameter or less of the tracheal tube. So what is the ideal size of the tracheal tube? So half the size of the tracheal tube will be selected for the suction catheter. Once the suction catheter is ready, the suction catheter can be connected to the suction source. So suction source can be either a portable suction or a wall suction unit. So portable suction is nothing but we can move the suction apparatus and we can bring it near to the patient, or we can keep it aside. So wall suction, which is a permanent one which is fixed to the wall. So this wall suction we cannot mobilize, but portable suctions we can move. What is the recommended suction pressure? So how much pressure we need to apply when we are doing suctioning? So always we should be very careful while applying pressure over to the tracheal tissues, upper respiratory or the lower respiratory. So the usual recommended suction pressure for an adult, if it is a wall mounted, it is 100 to 120 mmHg, or it is a portable unit, we can use 10 to 15 mm of Hg for adult. For children, if it is a wall mounted, 95 to 110 millimeter of Hg, and a portable type, it is 5 to 10 mm of Hg for the children. For infant, for the wall mounted unit, it is 50 to 95 mm of Hg, and for a portable unit it is 2 to 5 mm of Hg. So always we should maintain the pressure. If we are not maintaining adequate pressure, it can cause damage to the laryngeal tissues. Types of suctioning or methods of suctioning. There are two methods of suctioning. So the one is open suction system and the other one is the closed suction system. In open suction system or in open suctioning, the patient is disconnected from the ventilator and a single use suction catheter is inserted into the endotracheal tube to remove the secretions. So this type of open suction system is regularly using system in the intubated patients. In closed suction system, the suctioning allows a suction catheter to be inserted into the endotracheal tube through a one-way valve. In this case, we no need to disconnect the patient from the ventilator. So this is used to facilitate continuous mechanical ventilation and oxygenation during the suctioning. Closed suctioning is also indicated when the positive end expiratory pressure, that is PEEP level, above 10 centimeter of water. Equipments for suctioning. So what are the articles we have to get ready before doing suctioning, which includes a towel or moisture resistant pad which we have to keep it on the chest of the patient, portable or wall suctioning machine with tubing and collection receptor. So this is the one which will provide the adequate pressure to suck out the secretions from the respiratory tract. Then sterile disposable container for fluids and sterile normal saline or water. This is to just clean the suction catheters. Then sterile gloves, goggles or face shield to prevent the spillage of respiratory secretions onto the face, sterile suction catheter kit, water soluble lubricant to lubricate the tip of the catheter when we are inserting into the respiratory tract, sterile gauzes, moisture resistant disposable bag to dispose the catheter, and the sputum cuff. So immediately if the patient want to cough off the sputum, a sputum cup can be given. So these are the articles or equipments required for suctioning. Procedure. So while doing sectioning, the following should be monitored prior to or during or after the procedure. Breath sound should be monitored before and after the procedure. And oxygen saturation should be monitored before, during the procedure and after the procedure. Respiratory rate and pattern of respiration. Hemodynamic patterns like pulse rate, blood pressure should be monitored before and after the procedure. Cough effort, how far the patient can cough out the sputum, and the sputum characteristics, what is the color, the volume and the consistency and the order of the sputum, and the ventilator, if the patient is in ventilator, the ventilator parameters also should be checked before and after at the procedure. So if the patient is conscious, explain the procedure to the patient. Before doing the suctioning, we should hyperoxygenate the patient. The patient should receive a hyperoxygenation by delivery of 100% oxygenation for 30 seconds prior to the suctioning, either with an ambu bag or with the FiO2 by the mechanical ventilator. By increasing the FiO2 in the mechanical ventilator, we can hyperoxygenate the patient before doing suctioning. Then position the patient in supine position based on the consciousness of the patient. Then auscultate for the breath sounds. So initially we have to prepare the required articles for the suctioning, make appropriate measurement of the depth of the insertion of the catheter and test the equipment. We have to test whether the wall mount or the portable suction catheter is functioning or not. So how much depth we have to insert the catheter, that also should be measured. Then we need to position the patient, then lubricate and introduce the catheter. So while positioning the patient, if the patient is a conscious patient, either semi-Fowler's position, head turned to one side for oral suctioning, for nasal suctioning with the head, neck hyperextended. For unconscious patient, we can provide a lateral position and with the patient facing the healthcare provider giving the suction. So before starting the procedure, we should check the functioning of the equipments, wall mount or a portable type of suction, whether it is functioning or not. And also we should check the pressure. So for the adult and the child, how much pressure is required, based on that we have to adjust the pressure. Then for oropharyngeal suctioning, pull the tongue forward. Do not apply suction during insertion. So advance the catheter about 10 to 15 centimeter along the side of the mouth into the oropharynx. So while inserting the catheter, we should not apply pressure. So in a rotatory motion, we have to insert. While removing the catheter, we have to apply pressure, and in rotatory motion, we have to take it out. So nasopharyngeal suction, advance the catheter along the nasal cavity without suctioning. Never force the catheter against any obstruction. If you feel any obstructions when we are inserting the catheter, we should not advance the catheter furthermore. While performing suctioning, clean the catheter and apply suction again. So if there is any mucus plug, anything, wipe off the catheter with a sterile gauze. Flush the catheter with the sterile water or the sterile saline to clean the inside of the catheter. There are chances mucus can go and plug inside the catheter. So very often we have to clean the catheter in the sterile water. Re-lubricate the catheter and repeat the suctioning until the air passage is clear. So during the procedure, allow 20 to 30-second intervals between each suction and limit suctioning to a 5 minutes in total. So very often we should not do the suctioning. It can cause damage to the mucosa. So when we are doing an nasopharyngeal suctioning, so alternate the nares for repeat suctioning. Encourage the client to breathe deeply and to cough between the suctioning. If you want to obtain any specimen for testing, obtain specimen if required. Promote the patient comfort. Dispose equipments and ensure availability for the next section. Assess the effectiveness of suctioning. So once the suctioning is over, we need to document the procedure. So always document or record the procedure, the amount, consistency, color, order of the mucus, client breathing status before and after suctioning, the respiratory rate and the pattern before and after the procedure, the oxygen saturation of the patient before and after the procedure. The complete vital signs should be checked before, during, and after the procedure. So, what was the finding should be documented clearly and legibly. If the technique is carried out frequently, it may be appropriate to record only once. However, the frequency of suctioning may be recorded. So maybe sometimes we will do suctionings 3 or 4 times, but when we are doing suctioning, make sure that we should not suction more than 10 seconds. So if you want to repeat it, wait for 1 minute and then again we can apply the suction. So if the technique is carried out multiple times, no need to document the multiple times, 1 time, 2 times. So more, instead of that, we can mention how many times we have done the suctioning. So what are the positive outcomes after suctioning? So if the suctioning is effective, there will be improvement in the breath sounds, decreased peak inspiratory pressure, increased tidal volume delivery during the ventilation. So there will be improvement in arterial blood gas values or saturation as reflected by the pulse oximetry, and there will be large amount of removal of pulmonary secretions will be there, and the patient will feel very comfortable after the suctioning. Complications associated with suctioning. So the complications can be either trauma to the airway when we give repeated suctionings, or if there is any obstructions and we keep on suctioning, there can be chance for trauma to the airway, hypoxemia, nosocomial infections, and cardiac dysarrhythmias. So what are some of the techniques we can use to minimize or decrease the complications? So suction only as needed. Very often we should not apply suction. So if you want to do suctioning for more than 1 2 times, we have to wait for 1 minute, then we can do the next suctioning. Then sterile technique should be followed. Hyperinflation, hyperoxygenation of the patient before doing suctioning, safe catheter size, no saline insulation should be done for the patient. So to conclude, suctioning is a potentially a harmful procedure if carried out improperly. So suctioning should be done when clinically necessary. It is not a routine procedure. The need for suctioning should be assessed at least every 2 hours or more frequently as need arises. It is the responsibility of the nurses to follow aseptic precautions and thorough assessment before and after the procedure to avoid unnecessary complications. These are the references. Thank you.